in the initial trials which came out for ARNI, there was a lot of question as to, do you give ARNI molecules only to people who have high blood pressure, normal blood pressure, or low blood pressure? And it was that the patients were divided into 3 subcategories: BP more than 120, 100 to 120, and even lower than 100. And it was found that in all the subsets of patients, you will get a benefit of ARNI in terms of all the outcomes we've spoken about: mortality, heart failure, hospitalizations, and morbidity, improvement in quality of life, and breathlessness. So we know that irrespective of the BP, if the patient tolerates ARNI, they will do well. Once we have this evidence in front of us, we know that we have to try and use this molecule for every heart failure patient whenever possible. Now, how do we do this? If a patient has high blood pressure or normal blood pressure, no problem. But when they have low blood pressure, how do we initiate or start ARNI? The rule is that if their blood pressure is lower than 100, we don't usually start ARNI, but once it touches 100 or goes above, by increasing their fluid hydration or reducing the diuretics, usually loop diuretics, if you reduce, you do get a little better BP. Once you get that and you can initiate the ARNI, then have a patient monitor his own blood pressure regularly at home, keep a track. We will also find that you have many ARNI patients who come with being on the molecule, having blood pressure of 90/60 or 88/50, but they are very well preserved. They will tell you that my BP may be low, but I'm feeling very energetic. I can walk for half an hour, I can do whatever I want, I'm active in my lifestyle. So their quality of life improves irrelevant to the blood pressure. So don't be concerned by a 90 or a 95 blood pressure, as long as the patient is okay, well perfused, passing urine, and having no changes or giddiness or other complaints like that. So we have to take it patient by patient and see what the patient is tolerating. If the patient doesn't tolerate a BP of 102, then we must reduce the dose. But if they are tolerating 92 or 94 systolic blood pressure, it's good to continue the ARNI and explain these problems to the patient that, look, the drug is doing benefit, so they must continue it and maintain the benefit that it is translating to their outcomes.